Hey, Dr. Barry Glaser here with another Aligner Insider Quick Tip video lesson. So I wanted to talk today about that patient. We all have that patient. They're in Invisalign treatment, probably an adult patient, and you do refinement after refinement after refinement, and the patient comes in and says, oh, but this one tooth, or I'm not happy, or I want them to be straighter. And you know, and probably the patient knows too, that they really haven't been compliant. How do you handle that situation? It's not such an easy thing to look at a patient and say, you're lying to me. It's certainly not a practice builder. So how do you handle a patient who wants more and more refinements, who wants their teeth perfect, but is far less than a perfect patient? This is a situation where dental monitoring comes in really, really well. What we do with dental monitoring is we have patients only change their aligners when they're ready. So instead of having a patient, let's say, cycle through a batch of aligners, not really wearing them well, not really making any progress in their treatment, being unhappy, and then blaming you or blaming the Invisalign, and then just you feeling guilty and having to do a refinement, the patient only switches their aligners when their teeth are ready. So with dental monitoring, a patient like that, if they're not compliant, are going to start to get no-goes. And the AI is going to hold the patient in an aligner set until they're ready to move forward. Now, for patients like this, I think communication is really important. So you have to make sure that you explain to patients, look, we're not switching your aligners weekly. We're switching your aligners when your teeth are ready. And there are times where the teeth are moving slowly. And I think it's important not necessarily to say when you're not wearing your aligners well. I mean, I personally have a hard time sort of having that conversation. So instead we say there are situations where it takes longer than a week for your teeth to complete their movements. And this way, instead of just refining and refining and refining, the patient cycles slower through a series of aligners, but hopefully you can keep them on track, get them done, and make them happy. I hope you've enjoyed this Aligner Insider Quick Tip video. I'm Dr. Barry Glaser. Thanks for watching.